origin, the epicranial aponeurosis. The insertion is the skin of the eyebrow, and the action is the raising of the eyebrow. Number 2 is the occipital frontal, occipital belly. The origin is the epicranial aponeurosis, and the insertion is epicranial aponeurosis. The action is the lens and the retracts of the scalp. 3 is the temporalis. The origin is the temporal lines of the skull. The insertion is the cranial process of the mandible, and the action is the elevating the mandible area. 4 is the orbicularis oculi, and it's the origin. The origin is the middle margin of the orbit, and the insertion is the skin around the eyelid. The action is the closing of the eyelid. 5 would be the orbicularis oris, and the origin is the mandible and the maxill. The insertion is the lips, and the action is the pursed lips. 6 is the masseter, and the origin is the zygomatic arch. The insertion is the superficial of the mandible, and the action is the closing of the jaw. 7 would be the sternocleidomastoid, and the origin is the sternum and the clavicle. The insertion is the mastoid process, and the A is shaking your head no. And 8 will be the deltoid, and the origin is the anterior surface of the lateral clavicle. The insertion is the deltoid stabilirosity of the humerus, and the action is the flexing of the shoulder. 9 will be the biceps bronchio. The origin is the coracoid process of the scapula. The insertion would be the radial tuberosity. The action is the flexing of the arm at the shoulder area. 10 would be the infraspinatus. The origin would be the infraspinatus fossa of the scapula. The insertion would be the middle base of greater tubercula of the humerus. The action would be the external rotation of the arm. It stabilizes the humerus. 11 would be gracilis. The origin would be inferior pubic ramus. The insertion would be below the medial condyle, and action would be adduction of the thigh or hip area. 12 would be the sartorius, which is below the inferior superior iliac spine. The insertion would be the upper medial surface of the shaft or the tibia, and the action would be the flexes of the abducts, lateral rotates of the thigh and hip. And 13 would be malleus, the nasalis, which is the nose area. The origin would be the maxill. The insertion would be the nasal bone, and the action would be the tip of the nose.